My name is Angela Winbush, and I'm here to speak about the physician admitting orders on our pediatric patient. The first thing you would note is the allergies, the height, and weight. That's just in case that we have to give medications that will be weight-based. And of course, it's important to know allergies. We're going to admit this patient to the pediatric intensive care unit under the care of Dr. Sharma. The patient's diagnosis is diabetic ketoacidosis. His condition is guarded at this time. Vital signs will be every 1 hour because he is in an intensive care unit and we'd like to know if anything changes in his vital signs. Activity as tolerated. This is a pediatric patient and we don't want to limit his activities. Blood glucose will be monitored every hour just in case it goes higher and we need to place the patient on an insulin drip, or if it drops low and we need to give glucose to get it higher. We want to keep a strict measures of what this patient takes in and what this patient takes out, or what goes out of the patient. Daily weight is important. We don't want any sudden weight gain, and we definitely don't want any weight loss. We want to make sure the patient is getting adequate nutrition during his stay in the hospital. Notify the physician SAT if anything changes. Any severe headache, mental status change, confusion, agitation, difficulty to arouse, decline or increase in serum glucose levels, and glucose levels less than 120. Glucose levels that are less than 80, serum potassium of less than 2.8. These are critical values that need to be addressed as soon as possible. We do want to keep the patient on a carb-consistent diet, but again, we are not limiting his nutrition. We want to start a long-acting insulin on this patient, Lantus. We're going to start at 20 units BID, or twice a day, usually before meals and before breakfast and then before dinner. We're also going to give him pre-meal treatments. We'll do a sliding scale insulin, and he's going to receive 5 units of insulin before each meal. We're also going to give him some Zofran, PRN just in case he develops some nausea, Pepcid to prevent stomach or GI upset, and Tylenol in case of a headache or pain. We're going to give him some IV fluids, normal saline with 20 milliequivalents of potassium to run at 25 cc's an hour to keep the patient hydrated, oxygen via nasal cannula to keep his SATs greater than 92%. And we also want to run renal profiles every 24 hours and check a BMP, or basic metabolic panel, every 4 hours to check to make sure he doesn't have an increased ion gap. Because this is a pediatric patient, it's important to notify the diabetes educator to get an educator in early so that we can identify his